This is a case of an abdominal aortic aneurysm in an elderly patient. The aneurysm is located in the infrarenal segment of the abdominal aorta. Ultrasound reveals an aortic aneurysm measuring 5 centimeters in length and with a width of 4.5 by 4.7 centimeters. The inner lumen of the aneurysm through which the blood flows measures about 2 centimeters in diameter. High-frequency transducer also further confirms the dimensions and the true nature of the aneurysm. A large blood clot or thrombus is present within the left half of the aneurysm. The thrombus measures 1.8 centimeters in width. In this image, we see a transverse section of the aneurysm. A sagittal section of the thrombus and the aneurysm is also seen now. Sagittal section further shows the true nature of the thrombus within the aneurysm. CT scan images show the aneurysm in the infrarenal segment of the abdominal aorta. The aorta also appears tortuous with multiple calcifications. These findings indicate a significant aneurysm in the aorta with a considerable thrombus present in the left portion of the aneurysm. Size of the thrombus and the aneurysm are important factors when considering the risk and approach to management for the patient. Color Doppler study of the abdominal aortic aneurysm show the following characteristics. The color Doppler shows the presence of an abdominal aortic aneurysm by visualizing the dilated segment of the aorta. The aneurysm appears as a localized bulging or widening of the vessel. Blood flow within the aneurysm appears turbulent within the dilated area, which appears as mosaic of colors rather than a smooth, uniform pattern. This turbulent flow is often seen in the aneurysmal sac. The maximum diameter of the aneurysm is typically assessed to determine the severity and risk of rupture. The measurement is important for clinical decision making. We can see the full extent and gradual development of the aneurysm as we move the transducer from above to the level of the aneurysm. The normal aorta is seen above, and as we come downwards to the infrarenal segment of the aorta, we can see the aneurysmal dilatation of the aorta. Color Doppler can assess the involvement of branch vessels arising from the aorta. In cases of severe aneurysms, these branch vessels may be compressed or obstructed by the aneurysm, leading to altered blood flow patterns. Both sagittal and transverse views of the abdominal aorta and the aneurysm should be studied to get a proper understanding of the true extent of the aneurysm. Abdominal aortic aneurysms are graded based on the size of the aneurysm. Grade 1, less than 3 centimeters in diameter. Grade 2 is between 3 and 4 centimeters in diameter, as in this case. Grade 3 is between 4 and 5 centimeters in diameter. Grade 4 is an aneurysm diameter greater than 5 centimeters. In addition to the grade, the ultrasound will also assess the following. The location of the aneurysm. The aneurysm can occur in any part of the abdominal aorta, but is most common in the infrarenal aorta, which is the part below the origin of the renal arteries. The shape of the aneurysm is also important. Aneurysms, as in this case, is fusiform, which means that it is spindle-shaped, and it can also be saccular, which means it is pouch-shaped. The wall thickness of the aneurysm is also considered. The wall of the aneurysm can be thick or thin. A thin wall is more likely to rupture. The presence of a thrombus is also to be considered. As in this case, thrombus is a clot that forms within the aneurysm. The presence of a thrombus can increase the chances of a rupture. The prognosis is also determined by the ultrasound findings. Abdominal aortic aneurysms that are less than 5 centimeters in diameter are typically not life-threatening, as in this case. Abdominal aortic aneurysms that are larger than 5 centimeters and showing signs of rupture are at risk of complication such as rupture, dissection, and embolization. The presence of a thrombus in the aneurysm is a sign of stability. The patient's age and other medical conditions should be taken into account when making treatment decisions. Aneurysms that are smaller than 5 centimeters in diameter are typically monitored with ultrasound. In this case, a follow-up ultrasound has been advised. If the aneurysm is larger than 5 centimeters, then surgery is usually recommended. The two common surgeries done for aortic aneurysms are endovascular aneurysm repair and open surgical repair. Endovascular repair is a minimally invasive procedure that involves inserting a stent graft into the aneurysm through a small incision in the groin. The stent graft expands inside the aneurysm, reinforcing the walls and preventing it from rupturing. Endovascular repair is a good option for patients who are not good candidates for open surgery. Open surgical repair is a more traditional procedure that involves opening the abdomen and directly repairing the aneurysm. Open surgical repair is usually recommended for patients with a large or complex aneurysms. In this patient, follow-up ultrasound was advised.